This is the heel strike phase. The ground reaction force is anterior. My hip extensors, glutes, and hamstrings are activating concentrically to move my hip from flexion to extension. At the knee, the ground reaction force is anterior to posterior. My knee extensors, quads, are activating eccentrically to control the degree of flexion and prevent buckling. At the ankle, my dorsiflexors are activating eccentrically to lower the sole of my foot to the ground, and the ground reaction force is posterior. For the foot flat phase, the ground reaction force is anterior to my hip, and my hip extensors are activating concentrically. For the knee, the ground reaction force is posterior. My knee extensors, quads, are activating concentrically to extend the knee into mid-stance. At the ankle, my plantar flexors are activating eccentrically to control closed chain dorsiflexion as my body moves forward on the ankle. During this mid-stance phase, the ground reaction force is posterior to my hip, and my hip flexors, iliopsoas, are activating eccentrically to control hip extension. At the knee, the ground reaction force is anterior. My knee flexors, my hamstrings, are activating eccentrically to control knee extension. At the ankle, the ground reaction force is anterior. My plantar flexors are activating concentrically to push my foot off the ground and propel my body forward. During heel off, the ground reaction force is posterior to my hip. Then my hip flexors, iliopsoas, are activating eccentrically to control hip extension. At the knee, the ground reaction force is anterior, and my knee flexors, hamstrings, and plantar flexors are activating concentrically to bend my knee. At the ankle, the ground reaction force is anterior. My plantar flexors are activating concentrically to push my foot off the ground and propel my body forward. During toe off, the ground reaction force is posterior to my hip. My hip flexors, iliopsoas, are activating concentrically. At the knee, the ground reaction force is posterior. My knee extensors are activating eccentrically to control passive knee flexion. At the ankle, the ground reaction force is anterior. My dorsiflexors are activating concentrically to move the ankle from plantar flexion to neutral and clear the foot when it swings. This is the start of the swing phase. This is acceleration. My hip flexors are activating concentrically. My knee extensors are activating eccentrically, and my ankle dorsiflexors are activating concentrically. During the mid-swing phase of swing, my hip extensors, glutes, and hamstrings are controlling forward hip flexion momentum, as well as my knee flexors are activating eccentrically to control the momentum of my knee as it extends. My dorsiflexors are activating isometrically to keep foot clear and prepare for heel strike. This is the same for the next phase of deceleration. This is an example of glute max gait. When the glute max is weak, the trunk moves backwards. It occurs on the heel strike on the weak side and interrupts the forward motion of the trunk. This compensates for weakness of hip extension. This is an example of steppage gait, increased hip flexion and knee flexion during the swing phase to compensate for a patient who has foot drop, which is decreased ankle dorsiflexion. This is circumduction, a compensation that occurs during initial and mid-swing due to inadequate hip flexion and knee flexion or insufficient dorsiflexion, anterior tib weakness. This is a compensation using the QL that occurs during initial and mid-swing called a hip hike. This is also due to inadequate hip flexion and or knee flexion and insufficient dorsiflexion.